Hi, I'm Lindsay Sawtell. I'm a P3 pharmacy student at the University of Connecticut. And for the virtual health fair, I'm going to be discussing my research on the medical marijuana and recreational marijuana program in Massachusetts during the pandemic, when on March 24th, 2020, essential businesses were the only businesses that were allowed to stay open, and the state of Massachusetts did not deem dispensaries, recreational dispensaries, as essential businesses. So before the pandemic, a patient that used marijuana medically had three options of obtaining marijuana. They could register in a state medical marijuana program, in which they would have a certification to access medical dispensaries and all of the benefits that come with that. They could purchase as a recreational customer, or they could illicitly purchase the drug. So they had this decision before the pandemic of whether or not to enter into a state medical marijuana program. The medical advantages of registering are that the dispensaries use electronic health record. So a patient's progress is tracked, the dosages and the forms of the drug that they use are tracked, as well as their other medications, and they interact with pharmacists to make clinical decisions. And the products that get sold through these medical dispensaries are tested for strength and impurities, making it safer for patients. And there are increased potency and purchase limits as compared to buying marijuana recreationally from a dispensary. The patient advantages of the Massachusetts medical marijuana program, beyond the medical advantages, are there are no taxes on the purchase, where if you're buying as a recreational customer, taxes can be really high. The dispensaries allow for home delivery of a product, which makes it more like a pharmacy than it does a dispensary, because right now dispensaries in Massachusetts cannot deliver. And there are discount and loyalty programs that you can use as a patient. A patient might choose not to register for one of these programs, though, so they don't have that provider interaction. They don't have to go to their doctor and ask for the medical marijuana certification, as compared to illicitly purchasing marijuana. There is a higher cost associated normally with going to a medical dispensary. That initial provider visit that I mentioned costs about $150 to $200. So that's money that the patient has to spend to get certified. There is a lot of unease about legality and being on a registry, because marijuana is still federally illegal. So patients don't want their name attached to this. There's no tax if it's illicitly purchased. And there are concerns, especially in veterans, regarding VA care, because that is a federal healthcare system and marijuana is federally illegal. Before the pandemic, these hurdles were all there, and the Cannabis Control Commission took a few steps to encourage registration to medical marijuana programs after feedback when they first opened. The first was automatic issuance upon provider recommendation, which no wait time, which basically means that in Connecticut right now, if a patient applies for medical marijuana and gets approved, they may have to wait about 1 to 2 weeks for their certification card to come in. Where in Massachusetts, they changed it so that a patient could get product right after that initial visit. There was no wait time, and that encouraged patients who wanted it now to be able to get it as soon as possible, rather than deterring them from entering the program. There was also elimination of patient registration fee. Previously, there was a $75 fee for patients to enter, and that deterred patients, because that's $75 that they could have just not paid and gone as a recreational customer to these dispensaries. So like I said, Massachusetts decided that recreational marijuana dispensaries were not essential businesses. Of the states that have recreational marijuana, only 3 of these states, Massachusetts, Vermont, and Maine, decided that recreational marijuana was not a essential business. And there's always speculation that because there are these 3 options, there are probably many patients who use marijuana medically that don't go through the medical marijuana program. So when the essential businesses shut down, there was then a huge group of patients that didn't have access to marijuana the way that they would purchase it through either the recreational means. So as you can see, in March of 2020, there were 1,361 patients that applied to become a part of the Massachusetts medical marijuana program. And in April of 2020, after the pandemic and the recreational dispensary shutdown, there were 8,782 customers that applied to be in this program, new active patients. And in May of 2020, there was another new 6,750 patients. So these were all patients that were likely getting marijuana through the recreational means, and they then had to apply to the state medical marijuana program. So the Cannabis Control Commission in Massachusetts had to take a lot of steps during the pandemic, especially with the overwhelmed healthcare systems, to get as many patients as possible into the system. So they took a few steps, such as they allowed telehealth visits with providers for that initial provider interaction, which previously was not allowed. They had to allow for curbside pickup of medications at the dispensaries. They allowed the dispensaries to expand their delivery range so that more patients could receive their medications at home. And they motivated patients to order 60-day supplies, which previously wasn't necessary, but now it allowed for less transactions to happen at the dispensary. And they reviewed medical marijuana dispensary applications. So there were able to be more dispensaries that could convert to medical rather than just recreational. The failures of the COVID-19 response is patients with barriers to care, including lack of internet and lost income, cannot access this new care. If a patient was walking into dispensaries and recreationally buying the product, they would then have to now schedule a telehealth visit, which a patient without internet or a phone would be unable to do. And if they wanted to continue their care, they would have to resort to illicit marijuana. Patients need to find registered providers for the initial visit. And so this initial telephone call is important to get the certification, but because of the pandemic, the healthcare system was really overwhelmed and there was no additional providers that signed up to be medical marijuana registered. So this increase in patients, all of these patients had to go to those providers that were already registered. And there was such a big increase that the system was overwhelmed. And the providers also faced overload as Massachusetts COVID-19 cases spiked early in April, which was so making medical marijuana not a top priority for these providers. And pharmacists have a big role in medical marijuana. They can identify patients using medical marijuana. They can encourage these patients to sign up for the Massachusetts Medical Marijuana Program. They can educate patients about how medical marijuana is a safer option than illicitly purchasing marijuana, and they can participate in conversations with patients about the benefits of medical marijuana. Thank you for listening. Have a great day.